Welcome to another episode on Public Health Answers. Health inequities have always been a challenge to society. As a spirit-level theory by Willickson and Pickett demonstrates, the more unequal a society is, the worse the societal health and well-being is. To get a deeper understanding on how now COVID-19 has influenced these health inequities, I'm honored to introduce you to Professor Sharon Friel. She's a professor of health equity and director of the Menzies Center for Health Governance at the School of Regulations and Global Governance, which is part of the Australian National University. Her research interests lie in global health, in social determinants of health inequities, and of course, many more research interests. So thank you very much for joining us today, Professor Friel. I'll start with my first question. How have public health policies impacted or influenced this inequity gap during COVID-19?
Really, the COVID-19 has really shone a light on the existing inequities within society and the existing health inequities within society. And the measures that have been put in place, the policy measures that have been put in place, have exacerbated those existing inequities. And so that's happened in a few ways. So if you think of the actual health policies that have been put in place and the distancing, the social distancing, which has meant being able to live in a household and the lockdown that's been required in many countries around the world. That means that you have to be in a safe and a secure living environment. And of course, not everybody is. It means that you have to be able to work from home, and certainly not everybody can do that. And those people who are much more likely to have the sort of housing arrangements, conditions, that have the working conditions, that enable them to be at home and live in a safe and secure environment as a requirement of the distancing and the lockdown measures, are much more likely to be at higher socioeconomic groups. And so the risks to social and health inequities just from those issues alone have been exacerbated from that. And then on top of that, are some of the challenges. So they're not public health policies, but they are the policies and the actions that have happened as a consequence of trying to protect the economy because of COVID-19, which have all sorts of implications for health inequities. And just one example is, of course, people being stood down from work, from not having the protections, the working conditions and the social protections to both provide sufficient income, but also the wider protections that come from that. And that you mentioned the income inequality, the work by Willickson and Pickett to do with the income inequality and health inequality. And of course, that has just been absolutely exacerbated because of COVID-19's impact on the economy and the labour market. So lots of different ways that COVID is affecting health inequities.
Which role does urban health and urban environment play when considering health inequities and COVID-19?
Yeah, so the urban environment, again, shines a light on some of the existing inequities that we have in society. So there we were in lockdown, or depending on what level of lockdown, and our built environment, our urban environment, our very local built environment became our refuge. So when we could leave the house, it was to go out into a very small perimeter around our homes. And again, the quality of our actual housing, but also the quality of our neighbourhoods, both the physical quality. We know that the green environment, green space is so important for mental health during times of COVID-19. You've been able to be out in green space has been really very important, both just for being in green space, but also to be physically active. And that's so socially graded. Certainly here in Australia, the green space and the attractiveness, the safety within the green space in parks, in urban environments, it's not very good in those neighbourhoods where there's been neglect, and much more likely to be lower socioeconomic groups, across racial divides as well. So the urban environment has been very protective for people's, particularly their mental health, but also physical, for being able to be out and about. But when that urban environment is not safe, it's not physically attractive, it's not conducive to being out there, which is much more likely among socially disadvantaged groups, then I do fear that will have played a role in exacerbating health inequities. And it really tells us that actually how we design and plan and maintain our urban environments could be done in a way that really reduces health inequities. Going forward, there's such opportunities there.
How can we translate scientific data on health inequity and COVID-19 into action?
Well, if you think of, so I speak for here in Australia where I live. So Australia, the Australian government has responded, the COVID-19 response has been guided pretty much from day one, has been guided by scientific evidence. Now that's marvellous. The response, the policy response has been guided by the evidence. And what that's meant is really for the first time, health and the economy are sitting side by side. And so that scientific evidence around health, around public health, the epidemiology, who knew what epidemiology was before this? But of course, it's the epidemiologists that are standing up addressing the nations on a daily basis. And I do think there's such an important moment right now where health, as I say, health is up there. It's in the political, it's in the public discourse, along with the economy. Never before, never in my lifetime, have they been so equal. And what that's telling us, it's not an either or. It's not just about health and it's not just about the economy. They're so tightly connected. And so for us in public health and the demonstration, the use of the scientific evidence to show that evidence-informed action saves lives, and evidence-informed action evidence can also inform action on those underlying social conditions, social determinants of health that would also save many, many more lives going forward. So I think we've got such a real opportunity to keep the elevation of evidence-informed policy. Now, evidence is not the only thing that ever determines what policy is going to look like, but we've seen how it can actually happen. It's marvellous. That, of course, hasn't happened in every country around the world. I absolutely recognise that, but I've seen it firsthand here in Australia, and it can happen.
Can you name practical approaches for young public health professionals to actively reduce health inequities during times of COVID-19?
Yeah, now is your time. This is your moment. So I think there's lots of different ways that you can do this. I think there's lots of ways of building coalitions. So I would say the youth movement more broadly, not just in health, but the youth movement More broadly, we've seen it in climate change. We've seen it also, I think, in Black Lives Matter, so all of the discourse around racism and structural violence. And now, of course, with the pandemic, that the youth voice is being heard. It strikes me that it's less tokenistic than it might have been in the past in terms of actually listening. So I think the building of youth coalitions across so the youth health professionals working in coalition with the climate change youth movement and other social issues can really bring attention. And what that does is raise political consciousness, collective consciousness around issues. Through those coalitions, you bring that evidence to bear, and not only the evidence about what the problems are, so yes, shining the spotlight on the health inequities that exist around the world, but also articulating pathways forward. And that's the use of evidence that is about, okay, well, this type of policy, so we were just speaking about urban planning, the design of green spaces, using the evidence to articulate that actually action in those issues will go a long way to address health inequities. So you articulate and use the evidence to demonstrate some of those pathways towards intersectoral action. And I think you can also, through a kind of coalition of young professionals, sensitize your workplaces, your institutions of study, your institutions of work, and that you identify some of the structural drivers of health inequities, for example, in the workplace, where we experience issues of harassment, of bullying. These all affect people's mental health, and that happens differentially. So you're there articulating that. And then a final point, I think, as an action, is accountability. And I would love to see a youth, young health professional movement constantly monitoring and again, the shining the light of the great actions that are taken, and then also really the shaming where the actions do not occur. And that can be done again in those broader coalitions with other movements, other groupings of young professionals. So I do think this is the moment for young health professionals to work as a collective and use your voice, which is now, I think, really getting to be at the table in these decision-making processes, to articulate what an alternative might look like.
So thank you very much for your key insights, and also on elaborating on the power of youth, as well as on the impact of urban environment on our health, which then correlates, of course, to health inequities. So thank you very much for being part of this program.
Delighted to talk with you. Thank you.